None of the authorities are recommending this treatment, but 99% of doctors know this medication, how to use it safely. It's relatively inexpensive and it has few drug interactions. No, this isn't some rubbish Donald Trump hydrochloroquine plug. This is evidence-based medicine. And if you're new here, my name is David Tong. I'm a registered pharmacist with over 15 years experience in both community and hospital settings. Today, we're going to break down a fascinating clinical paper that I read in the New England Journal of Medicine, the gold standard of peer-reviewed publications. But stick around to the end as I reveal an eye-opening but free resource you can use to look at your risk of developing long COVID. Now you might be wondering, long COVID, what's the fuss? Plenty of people live with chronic viral conditions for long periods of time, like hepatitis, like HIV. Well, in this paper here, also published in the New England Journal of Medicine, investigators found a 9-point drop in your IQ if you had severe COVID. The brain fog is real, and we're still unsure what sort of vascular damage the virus can cause. On top of that, we know the viral shedding is quite aggressive in our body, and with persistent infection, the virus can move from our respiratory tract into other areas of the body, like our gastrointestinal tract, which is why the government does sewerage surveillance monitoring to track COVID rates. My point being, it's not something you want to play around with. This is your life, this is your health in your hands. My number one advice to people would be to stay up to date with your booster vaccines. But that's not why you're here. I know you want to know, what is this medication that everyone seems to be sleeping on, but seems to be able to cure the world? Well, it's called Metformin. And for those of you who don't know what Metformin is, it's the first line treatment for type 2 diabetes. But in this fascinating clinical paper that I'm about to show you, it's showing very strong evidence in being beneficial in reducing the risk of developing long COVID. Now, being a pharmacist, I'm a big believer and only believer in evidence-based medicine. So let me break down this clinical paper into 4 easy steps, as I've showed many of the viewers on this channel. And if you want to watch that episode, click the link below. The paper is titled Outpatient Treatment of COVID-19 and the Incidence of Post-COVID-19 Condition over 10 months, a multi-center randomized quadruple-blind parallel group phase 3 trial. It's a very well-run trial conducted by Bramante et al. Start with the first point that I look for in any clinical paper is, why did they do the study? Well, the abstract tells us that they aim to investigate if outpatient COVID-19 treatment with one of 3 medications, Metformin, the anti-diabetes product, 2, ivermectin, an anti-parasitic product, or fluvoxamine, an antidepressant, could lead to a reduction in the risk of developing long COVID. It's the first ever randomized placebo-controlled phase 3 trial evaluating the effect of outpatient COVID-19 treatment on long COVID. And it's also one of the few trials that enrolled pregnant women, something we just don't see in clinical trials. Now, the second thing I look for, how did they run the trial? It was run out of the US across 6 sites with patients aged between 30 to 85 years old, which is a nice spread, but majority of these were overweight or obese, so arguably pre-diabetic or having some underlying level of diabetes. In terms of patient numbers, over 1,000 people completed the trial, so this is very robust numbers. And the primary outcome they were looking for in this study was to see if patients, after 2 weeks of therapy on one of the 3 medications I mentioned earlier, had any signs, symptoms of long COVID. The third piece that I look for, what did they actually find? And it's fascinating. There was a hazard ratio of 0.59 with the Metformin group, indicating a 41% reduction in the risk of developing long COVID, which is almost halving the risk. What's even more interesting is when metformin was started within 3 days of symptom onset, subgroup analysis shows a hazard ratio of 0.37, which is a 73% reduction in the risk of long COVID. That is incredible numbers. Unfortunately, ivermectin showed no difference with a hazard ratio of 0.99, meaning it reduces your risk of long COVID by only 1%. And interestingly, fluvoxamine, the antidepressant, actually increased the risk of long COVID with a hazard ratio of 1.36. Now, the fourth and final point that I look for in a clinical paper is, what do the findings mean? How do they apply to the real world? And to summarize, it would be people who are overweight or obese, and I'd lean more towards people with a BMI of over 30, because 47.2%, almost half the patients, had a BMI of 30 or greater. And age between 30 to 85 years old should consider asking your GP for Metformin for 2 weeks following onset of symptoms with COVID-19. Now, if you're not within the 30 to 85 year old age bracket with a BMI greater than 30, then unfortunately there is no evidence that Metformin is going to benefit you, and I would revert to traditional measures. My advice would be to get vaccinated, because this is the safest method to protect yourself from developing long COVID. I've already talked about some of the implications long COVID can have on our body. And one thing to really bear in mind is the more infections that you have with COVID-19, the higher your chance of getting long COVID. What I mean by that is if you get COVID 3 times compared to someone who's only had COVID once, you are 3 times more likely to have long COVID than this person here. And if you want to know why having a sore arm, headache, tiredness after a vaccine booster shot is actually a good sign, click the link below and let me explain. I'll also give you 2 bonus tips on how to prevent getting COVID. As they say, prevention is always better than cure. So what is this free, eye-opening resource that I promised? It's called the CoriCal, and it's been developed by an independent body, independent from government, independent from the big pharmaceutical companies. It's a really cool tool that allows you to enter your age, your gender, any comorbidities, whether you've had a previous infection, and it shows you the benefit of having a booster shot, antivirals, Metformin where applicable, and what impact of increasing infections can have on your risk of long COVID. If you like this video, please give it a thumbs up. And if there's some people out there who you think can benefit from the use of Metformin, please share this video with them.